Welcome to our third webinar of our first series, of hopefully the beginning of a lot more, about increasing inclusivity in setting priorities and reaching consensus in research priority setting exercises. Thank you very much for coming for us. This will be an exciting one because we move on to a much more advanced methods about how we conduct priority setting research. Before I start the webinar and introducing the first speaker, I do like to point out to you how this webinar works. The webinar, it is recorded. As you might see, you cannot unmute yourself or to talk, but you can submit your question in the question answer part that is in the panel in the lower row before under the main screen. So there's a Q&A, and if you click it, you can send your question, and then we answer your questions after the presentations are finished. Feel free to send the question anytime during the presentation. We will answer them at the end. You can also use the chat function, but that's actually the Q&A function is a better function for us to have all of the questions in one place. So thank you very much for that. And I start with the first presenter that we have. Our first presenter is Dr. Seilin. She's a senior research fellow at University of Southampton, and she will be talking about different methods of consensus. And I think she has some interactive parts for us. So be engaged, Seilin.
All right, thank you very much, Mona. I'm just sharing my screen and hopefully people can see. So before I start, okay, I'd like to acknowledge the support behind this research. This work was funded by the PIHR, and a huge thank you to my supervisor, Professor Sandy Oliver, who has shaped my thinking in more ways than I can count. And of course, I'm indebted to incredible contributors to the James Lind Alliance pre-Thunberg's priority setting partnership. Now, I thought it would be nice to introduce my background briefly. So I studied media and communication and then changed to psychology during my master's and ended up in this public involvement research for my PhD. And then I was fortunate enough to work in South Korea teaching media and communications again. So my academic career is mixed with the communications and psychology. So since returning to the UK, I've been involved in several interdisciplinary projects that bridge these two areas, particularly focusing on how people engage with health information and how we can improve communication between researchers, healthcare professionals, and the public. So this blend of disciplines really informs the way I approach research, with a strong interest in participation, accessibility, and meaningful dialogue between communities and academia. Now, to begin with, we are going to make a group decision. So if you are now part of a team that has to buy one car together, so we've got three choices, all perfectly acceptable in their own way. You've got 5 seconds to vote. So the facilitators, if you can launch the vote, no analysis, no further information, but just go with your instinct. So I will count 5, 4, 3, 2, 1, and the poll. So the second choice is the most popular. Now we are going to discuss why we have chose this car. So give me one reason why you chose the car. Was that the design, the fuel efficiency, the off-road capability, or maybe you just like the color, and type your reason in there. Can you see the answer from the poll? Okay, I will give you maybe a few more seconds. So there is a time pressure. Okay, let's stop here. So end the poll, and can we see the free text?
I cannot see it, Seilin. You might
Sorry,
have to.
I'm trying. Sorry.
Yeah. So I'm wondering why the reason why you chose that car to see whether the reasons are similar or different. But if we
Sorry, I can't work out how to see
it's
them.
okay.
Give me a
If we
second.
can see the reasons, at least you know which car is the more popular than another. We can do the poll again, and now you've seen others, the not results but the outcomes. Would you choose differently? Let's vote again. 5, 4, 3, 2, 1. Okay, we have more votes for number 2, and there's no vote for number 3. Gosh, that's interesting. Okay, so that was a little exercise. Some cars gained support, others lost a few fans, and that quick shift without much new information is a small but powerful example of how social influence and group interaction affect decision making. This might have felt like a game, but it mirrors real consensus methods. So if I send you that poll privately over multiple rounds with a feedback in between, that's the Delphi process. If I put you in a small groups to discuss before voting, that's like a nominal group technique. And if I made this public debate with experts and lay people, that's a consensus conference. Same underlying dynamics, but different packaging. There are some methods on consensus development. Each has different level of structure and power dynamics. I've got a nice visual, which is taken from my thesis and illustrates various formats for consensus development, ranging from highly structured to loosely organized approaches. Each method facilitates or constrains particular types of thinking and enables different forms of influence. This does not suggest that one approach is inherently superior to another, or that method positions centrally is necessarily optimal. Rather, it highlights the importance of selecting an appropriate consensus development method based on the desired level of formality and the specific mode of the process. Now I'd like to share my actual study. This was the James Lind Alliance Pre-Converse Priority Setting Partnership, which I coordinated over the 3 years' time. It involved patients, clinicians, and researchers working together to identify the most important unanswered research questions. The participants submitted over 3,000 suggestions, which were distilled into 40 questions and finally discussed in a facilitated workshop with 18 participants. So I analyzed the data from observation notes, meeting recordings, transcripts, and participant recollections. I wanted to know how do they interact when making collective decisions and what makes their messages more persuasive than others. I used the qualitative method, observing meetings, etc. I then applied the elaboration likelihood model to see how persuasion was actually happening in real time. Now, briefly, this is the analytical framework I used to understand how people are persuaded. This is called elaboration likelihood model of persuasion, or ELM. So you've got two different routes to persuade messages. So you think central route, or you think hard, weigh evidence, and analyze. Peripheral routes, on the other hand, you rely on emotion, style, or social cues. So let's go back to the car vote. If you pick the SUV, because you need it for off-roading, that's essential. If you pick the Tesla because it's sexy, that's peripheral. If you rejected it because of Elon Musk, still prefer, or it could be central depending on the reasons behind. If you rejected it because of the price or battery reliability, that's essential again. And see how our thinking styles shift depending on what information we are using or avoiding. Now, these are some peripheral cues defined by Cialdini's 6 principles of persuasion within the ELM's framework. And they often operate as a peripheral cues, especially in consensus discussions. When people feel rushed, don't have enough time to make decisions or trust a particular dominant speaker. In my group, there was a very experienced consultant surgeon who had a strong voice, or just want to be agreeable. They often not processing it centrally. So this doesn't always lead to a bad outcome. Sometimes if you use it wisely, it can you can get positive outcomes with using peripheral cues, but it can limit the diversity of viewpoints. Here are some findings from my study. So I analyzed the data doing clinicians and service users communication patterns by using this analytical framework. Clinicians often use the evidence-based reasoning. They were grounded in the feasibility in particular and scope. Parents, patients contributed strongly, often using personal and community perspectives, and some central root, some emotional peripheral inputs. I also compared the communication patterns between steering group members and new participants who joined just for the final workshop. So the steering group members, they worked together over the 3 years time together. And I found that they generally use the more logical arguments rather than emotional arguments, unlike the new participants. When they were using peripheral cues, the most common peripheral cues were like a commitment and consistency. Commitment is like, because we have agreed to do this, we have to do in this way. Consistency is like we did this all the time, so we are sticking there. So that these were the most popular peripheral cues. This slide illustrates 3 key pathways to achieving effective consensus based on my study. First, we have central root persuasion. This refers to persuasion achieved through the logical reasoning and detailed information processing. It involved careful scrutiny of arguments, which can be especially important in more structured or formal deliberative settings. So when people use the central root persuasion, it was more powerful than the peripherally used discussions. Secondly, the trusted message represent pathways where the content is accepted because it is perceived as credible and reliable by the recipients. And here the messenger's authority, clarity of communication, and alignment with the audience values play a central role. Lastly, shared legitimacy. It refers to outcomes that are recognized as valid and accepted by all parties involved. And this may not always stem from the detailed persuasion or perfect information, but rather from inclusive process that confer a collective sense of fairness and ownership. Now we often talk about skilled facilitation as an important thing for the high quality consensus. Here are some findings from my study. First, skilled facilitators guided participants through disagreement. Rather than avoiding conflict, they helped the group navigate it productively, ensuring that differences of opinions are acknowledged and addressed without derailing the process. The second, they clarify the complex points. Discussions often involve technical, ambiguous, or emotionally charged contents. Our facilitators help to make these issues more accessible, ensuring that participants have shared understanding of what is being discussed. So they often paraphrased what the other participants mentioned and formatted into more acceptable wording. Third, they encouraged contributions. So this involved creating a safe and inclusive environment in which all voices are heard, and particularly those who might otherwise remain silent. Inclusivity was key to generating more legitimate and well-rounded outcomes. Finally, facilitators summarized fairly. This means capturing the essence of the discussion without bias, ensuring that all perspectives are represented accurately in summaries and also decision-making process. This is my final, almost final slide, and I wanted to mention the impact of humor in facilitation, which, while often overlooked, plays a subtle but powerful role in group dynamics. First, I found the humor helped to ease tension in moments of disagreement or emotional intensity. A well-timed, light-hearted comment can diffuse defensiveness, enabling participants to re-engage with discussions more openly. Second is smooth transitions. So shifting between topics, activities, or emotional states in a group setting can sometimes be awkward. Humor acted as a kind of social lubricant, softening these transitions and helping the group stay cohesive. Finally, humor could boost morale. It creates a sense of connection and shared experiences, and contributing a more positive and energized atmosphere. And this can be particularly valuable in longer or more challenging deliberative process. And crucially, this isn't about making the group laugh for its own sake, but rather it's about using humor strategically and to maintain momentum, lower barriers, and foster more human, engaging process and facilitation. So that's all about it. Here are some references for my study, which is accessible publicly. And if you have any questions, please do let me know. I will stop share.
Thank you very much, Seilin, for the first presentation. Our second one, and everybody, please keep your questions, put them in the Q&A, and we answer them at the end. Our next presenter is Soumyadeep Bhaumik. He's the head of the Meta Research Evidence Research Synthesis Unit at George Institute for Global Health. And he would be talking about a single-stage consensus method for research participating exercise. Why, how, and what we learned.
Good morning and good afternoon, good evening from wherever you are joining. And thank you, Mona, for the introduction, and Seilin for setting up the stage in a very nice manner and bring a bit of the theory into the process, which is often overlooked. So I will be talking about single stage consensus methods. But before I do that, just to give a bit of a background of myself, I am trained as a medical doctor and as an international public health specialist. I work on research and evidence synthesis space, and quite interested in justice and equity in the knowledge ecosystem. Our team, which is the Meta Research and Evidence Synthesis team, is spread across Australia and India, and we work quite a lot with different type of interest holders in the space. Because I'm from Australia now, I would like to acknowledge the Gadigal people and the Bijigal people of the Eora Nation, on whose unceded land I live and work. And I pay respect to all the elders, past and present, and to the children of today who are the elders of the future. So we all know that this session is about inclusivity, but I thought it would be good to talk about why inclusivity is important in setting priorities for research, especially under the current socio-cultural political environment where diversity, equity, and inclusivity are quite being challenged, and people are asking, is this needed? So there are four reasons. One is intrinsic. It's important because human beings have the right to be involved in anything which involves their lives. So that's a very intrinsic reason on why it should be happening. But there are also pragmatic reasons. If we engage interest holders who are involved in this process, they are more likely to accept it and more likely to implement it when the priorities are being developed. It is also more likely that the priorities that are developed in an involved manner are more relevant to the different interest holders in the process. There are also epistemic or knowledge related reasons, which is very similar to the pragmatic reasons, but it is more about how it can give a more robust set of priorities, how it can lead to identification of questions or priorities which have not been thought about because experts by the design are not really working very close to the field or the communities. And the last important reason for inclusivity is justice. We know that the world is not equal. Human society has never been, and it will never be too, probably. But inclusivity is a methodology, is an approach to actually try to mitigate that and balance that out. And justice is something which is cross-cultural in nature and every human identifies with. So that's why it's quite important to do that. So, and we all try to do that in research priority setting, but how do we do that is quite challenging. And this is where single stage methods come in. So we do have the theory behind is that single stage methods, because they're single stage, are time efficient, they are resource efficient, and they provide an intrinsic understanding of the process by the interest holders. Like everybody understand if it's a single stage, it's so simple. And the theory is that not theory, the hypothesis is that if that happens, we can do better inclusivity and probably lead to more uptake of research priority setting. So they are simple, they are fast, and because they're simple and fast, people are more likely to trust it than a complex multi-year, multi-month process which has multiple layers of things and people do not understand what is going on. And also it's much more flexible and adaptable in nature, and they are efficient. And this is quite important because we all want inclusive research priority setting to happen, but often we see research priority setting does not actually happen because people are trying to find resources for actually doing the research. So research priority setting falls off the priority of the research teams or universities or research funders. So single stage methods are actually quite good when this happens. It has also disadvantage. Sometimes they might not be transparent. They might not have depth. And they have something called a priori dependency, which is when the priorities that are finally arrived at really depends on where the people who are doing the research priority setting started with, what were the long list of questions or topic they started with. And there are often not a lot of processes to do that. So there are broadly three single stage methods: consensus meetings, nominal groups techniques, and single stage survey. And all of them are essentially looking at getting it done very fast and efficiently. And quite a bit of it was covered by Seilin. But just adding like single stage survey would be very simple. It would be just a survey and asking people to rate or rank priorities by their order. And that's very fast. You can reach a large number of people and it can be done. But again, it has quite a lot of a priori dependency. Consensus meetings are often quite challenging because there's lack of transparency, and as peripheral cues often dominate and influence the process, and it's really difficult to delineate between them. Nominal group techniques is also quite good, but it often has limitations in the number of people that can be involved because of the nature of how it's done. So there are pros and cons of each approaches. So what I will be talking a bit is about how we worked on a single stage survey for a really rapid, low cost research priority setting, which we did. So we wanted to set research priorities on climate change and health in India. And this is quite a big domain. And there's often a debate around what aspects of climate change and health should be try to do more research on. Do we need to know more on impact of climate change or to the policies or adaptation and mitigation efforts, because we really are running against time. So in that environment, we really didn't want to choose one aspect. So we wanted all types of domains to be included. So we developed this modules and 5 domains essentially, which we wanted to develop priorities on. So we worked a bit on the how to do this. So we had phase 1 in which we systematically mapped the evidence. We were not really looking at what the evidence was. We were looking at all the evidence from South Asia on climate change and health and extracting information, basic information on what the study characteristics were and also their objectives or research question. We were not really looking at what the results were. And then we also did an open-ended survey in which anyone from India who is above 18 years could participate. We got 190 responses. In phase 2, which is what mostly I will be talking about, we did a rating survey and in which we had 241 participants. And just to add a bit of context, most research priority setting processes would not have numbers going to hundreds. And it was quite extensive. We got really good coverage from different parts of India. So that was really good. But what we did was we divided the participants into 3 groups, researchers, practitioners, and basically anyone else. And when we did that, we asked people in phase 2 to rank each question which we got after merging the questions from phase 1 and what was already available and being done from the systematic mapping, and asked them to rate them into 1 to 9, where 1 to 3 corresponded to research question of limited importance and 7 to 9 corresponded to research question of critical importance. We had a priority consensus criteria, quite simple, more than 50% score of critically important, which is basically a majority mark, it goes in. But we also built in that none of the stakeholder groups should vote 15% or less. So that was consensus in. If it was opposite, it was consensus out, and any other rating was no consensus. Just to give an example of how this actually worked. So just give an example of this, you can see like all of them rated them critically important, so they are consensus in. This one narrowly missed the mark, whereas this one was consensus out. Similarly, this was also no consensus. So this is how the thing worked. So what we did good, it was very transparent. People knew what the criteria was. It was very simple, working like democracy. We also got depth in the sense we could cover all the 5 domains. So we have a modular question. People could choose some domains, but we could cover a lot. There was a bit of, because we used this 2 phases and we involved participants to also submit questions, we got a really long list of questions, which we had to work to thematically code and put them in appropriate orders for similar questions. And this was really good. And this long list of questions we believe is quite useful for future work too. We also got really good reach. The plain language helped, but we also learned that this modular nature is often quite challenging. Some modules were more popular than other. The scoring system, instead of like this 50%, 15% consensus in out criteria, really worked well. It was better than medians and means which we had used before, in which there was clustering and there was really not a lot of difference. So in previous art research priority setting, we had tried that. It's really better than that. We also learn that because this is single step, there's always a bit of a tension between consensus, whereas as versus conformity. This allows to show differences of how researchers and participants actually think. So that's one big difference. We also think that equity parameters was something which was needed to be more collected. As for example, we see that for Adivasi or the tribal people, researchers and practitioners did not say yes, but we really actually do not know a lot about that. So correcting more demographics on it is required. We also think deliberative sampling would be quite helpful. As for example, we should have probably targeted more people from Adivasi groups or communities and circulated the survey to them. That would have probably improved the equity and inclusivity better. Overall, there's a need for more methodological work. We are just scratching the surface. We think simple single stage surveys are really important. And that's all. Thank you very much.
Thanks very much, Soumyadeep. It was really interesting. Really that was a very good follow-up from what Seilin was talking about. Our next presentation is it's the postdoctors Sumanth Kumbargere and Prashanti Eachempati, who will be talking the multi-ethnic linguistic toolkit that they have developed to engage the participants. And both of them are clinical lecturers in dentistry at the dental school in Plymouth University and senior researchers with the Magic Evidence Ecosystem. Hand it over to you guys.
Thank you so much, Mona, and greetings to all the participants of this webinar. Thank you so much to Soumyadeep and Seilin for setting the stage regarding inclusivity. And today, Sumanth and I are very happy to share the findings and experiences from our PhD research, which led to the development of this multi-ethno-linguistic toolkit, which we call as MELT. So before we go into the presentation, we would like to ask you some questions where you can answer a poll. So the first question to you is, have you ever been involved in a research priority setting exercise that actively included diverse ethnic or linguistic groups? So please answer yes, no, or you're not aware, or you're just aware of such inclusions. So maybe you can take 5 seconds. So 5, 4, 3, 2, and 1. So let us look at the results. All right, so 50% of the participants said no, but we're very happy to see that 29% of you said yes, and 21 are aware of such inclusion. That's excellent. Let's move on to the second question. Do you believe that research priorities set without multi-ethnic and multilingual input may overlook important community needs? Yes, no, or you're not sure. So take again 5 seconds. 5, 4, 3, 2, and 1. Let us have a look at the results. Very glad to note that 85% think and nobody thinks it is not necessary and some are not sure. Thank you so much for participating in this, and I will take you through the presentation now. So just to give you a background about the multi-ethno-linguistic toolkit, we basically developed the MELT toolkit for the researchers who want to engage with multi-ethnic and multi-linguistic groups in any research projects. And this toolkit is developed based on the experience of our research projects. As I mentioned, the first research project was on multi-ethnic approach of stakeholder involvement to set priorities for oral health research. And the second one was focused on participatory research, where we try to explore how various ethnic groups of Malaysia perceive and respond to uncertainty in oral health decision making. In both these projects, we involved multi-ethnic groups of Malaysia who spoke different languages. And when we engaged them, we realized that there are so many challenges, so many nuances, and unique features to these different ethnic groups. And that is what led us to the development of this MELT toolkit. Now, do we really need a toolkit as such? I think the answer is a yes, because there is an agreed norm to engage diverse stakeholders in research priority setting exercise, but how exactly to do it is not very clearly mentioned in literature. So we have shared later on a QR code where we have our paper, where we mentioned the different other toolkits which are similar to this, but not exactly including individuals from different ethnicities, and especially not including language as a background. There is a need for procedural adaptation in the process of multi-ethnic, multi-language stakeholder engagement in research, and this justifies the need for such kind of a toolkit. How did we start collecting information to develop this toolkit? So as I mentioned from the first project, we had 40 community participants and 14 dentists, and these belong to the 4 ethnic groups in Malaysia. So the 2 predominant ethnic groups were the Malay and the Chinese, and we had 2 minority ethnic groups who were called the Baba Nyonya and Malacca Chetty. And we conducted semi-structured interviews, both face-to-face as well as virtual. And we gave choice to the participants to engage in their own mother tongue, Bahasa Malaysia or Mandarin, and some preferred English. We also had 9 translators who were involved with the project, and we had focus group discussions held with them during as well as after the project to gain their insights. We did the reflexive thematic analysis to identify the research priorities and also the reasons for prioritizing these topics. Moving on to the second project which we conducted, it is a participatory research with the multi-ethno-linguistic groups. So in this project, we had the Indian, Malay, and the Chinese who are the predominant ethnic groups in Malaysia. And what we did was to engage these participants by asking them to navigate in the dental environment, clicking photographs of what they perceived as uncertainty in the dental environment. So you can see in the next picture that we conducted 3 different workshops individually for the Indians, Chinese, and the Malays, and the facilitators were speaking in the mother tongue of these participants, and they engaged in different activities speaking in their own mother tongue. As a part of this PhD project, we also did one more exercise of translating an English questionnaire into the national language, which was Bahasa Malaysia, which was spoken uniformly by all the 3 different ethnic groups. However, when we engaged them in the translation process, we found that their mother tongue influences certain words and interpretation of words, which was very interesting and fed into the multi-ethno-linguistic toolkit as well. Not just from these PhD projects, as Seilin has explained to you, her PhD project, we took inputs from that experiences. We took feedback from Cochrane priority setting group members. We took feedback from the conference presentations, which we did, reflective notes, as well as feedback from priority setting training workshops. And all these fed into the multi-ethno-linguistic toolkit. Before I hand it over to Sumanth, I would like to share some few examples of some interesting experiences which contributed to the development of this toolkit. Firstly, the interpretation of words vary due to the influence of mother tongue. So as I mentioned, when we conducted this translation project, simple terms like uncertainty was interpreted very differently by the Chinese and the Malay ethnic groups, where the Chinese had a long sentence to express it because they did not have an equivalent word for uncertainty in their own mother tongue, whereas the Malays had just a single word to translate it. We also had very good experiences with mixed ethnic groups. Now, for example, an Indian married a Chinese. The child was a mixed ethnic and was called as Chindian. And we had some Chindian participants and they were confused. Should I go to the Chinese workshop or should I go to the Indian workshop? So we had to give them the choice to self-identify themselves and to go to those workshops they felt belonged to. And obtaining informed consent and making them read the participant information sheet was also a challenge with a particular ethnic group always asking us to just tell us where they need to sign without even reading it, because of the trust they had on the researcher and or the professional. And we had to modify our techniques and verbally read out these participant information sheets and informed consents, so that we are ethically moving in the direction of the research. So these are different experiences which we had, and these are few of the examples, and Sumanth will be sharing many more when he discusses the contents of the toolkit. Handing over to Sumanth now.
Hello, thank you, Prashanti, for the introduction of the project. The Multi-Ethno-Linguistic Toolkit, or MELT project, is still under the development. We have 11 sections under this toolkit, and 11 sections we have developed 7, and 4, the last 4, ranking process, consensus process, appeal process, and sustainability, are still under the development. So in the next few slides, I'll be sharing some examples and the content of this toolkit. The first stage is regarding the preparation for the research priority setting. In this, we have provided some checklists, and I am sharing one such example of the checklist here. The interviewers or translators should adapt to the culturally acceptable attire or dress code during the face-to-face interviews or video recorded virtual interviews. In case of interviewing different ethnic groups, have you considered this aspect? Why we have mentioned this in the checklist is because during our interview process, we observed that some of the ethnic groups were not comfortable with the translators who are wearing revealing dresses or having tattoos. So they were not taken very seriously. So this experience made us to add this as an item in the checklist. The second section of the toolkit is regarding formulating the focus and scope. In this section, we have provided the top 10 tips: who to involve, why to involve, complexity of language, ethnicity, and identification. I would highlight one example here, the characteristics of ethnic groups that might influence the research. If you are working with a society, you should be aware whether they are collectivist society or individualistic society. I can share a very good example of my own experience here. I was interviewing a person in a rural area, and I traveled to that rural area, and when I wanted to start the interview, almost entire village was there to witness the interview. And due to the issue of consent and secrecy of the data, I requested them not to be there and give us some privacy, but it was not well taken. And I was surprised when the interviewee himself told me that he doesn't have any secrets to hide from his friends and family members. So similarly, there could be a patriarchal society where presence of a male member is necessary for a female to sign the consent form. Under the third section of recruitment, we have provided some templates or flyers. You can see one such example here. These flyers are culturally sensitive, and you can see the icons here. They are wearing the mouth masks. You might be wondering why so, because this project was done during the COVID-19 pandemic. The fourth section is regarding managing translation and transcription. We have provided 20 tips for translation and transcription. I would highlight one aspect of this, that is, participants might use idioms or proverbs during the interviews, and these can be of great value, which needs to be discussed in the data analysis stage. So we have put the question, are the translators told to maintain originality of such idioms or proverbs? The fifth section of the toolkit is conducting interviews. Here we have provided the templates for interview guide and decision tool, whether to do face-to-face interviews or virtual interviews. Why this is important? Because some of the ethnic groups were comfortable with face-to-face groups. Some of the ethnic groups were not comfortable with the virtual interviews, especially when the videos are on. Regarding the sixth section, that is more of analyzing the data, tips for data analysis. Here I share the example. Have you considered the local slangs or colloquial expressions and the meaning of such slangs or expressions during the data analysis? Example, in Bahasa Malaysia language, adding la after certain words such as good la can mean acceptable, or adding giller as in best giller can mean exceptionally good. The last section, focus group discussions with translators, we have provided some templates for FGD, consent forms, and participant information sheet. We have sent this publication for a journal, and it is under the preprint stage. You can scan this to access the full text of this preprint version of the MELD toolkit. I'll give a couple of seconds for you to scan. If you are interested in the toolkit or need guidance on engaging multi-ethno-linguistic population, feel free to contact one of us. Before we end the session, can I request the facilitators to launch the final poll? Okay, I think we can end the poll. Yeah, it's surprising that none of them have considered language as a barrier. But in our research, we found that language was a major barrier. Yes, we agree that cultural differences, limited engagement of marginalized groups, and lack of resources or funding are the barriers. But when you intersect this limited engagement of marginalized groups, language could be one of the reasons why they are having limited engagement. Thank you. Thank you for your patient listening. And if there are any questions, we are ready to take it now.
Thank you, Sumanth. I think we can have all of the panelists back on, like Seilin, Soumyadeep, if you want to come back. So, questions. We have 2 questions. The first question is to Soumyadeep. I see you're already typing. The question is, did you use this plain language for all 3 groups of people, researchers, practitioners, and public, or did you adjust? Do you want to answer them? You're mute.
Hi, thank you, Joreen. Really interesting question. We use the same plain language for all the 3 groups of people, so everybody saw the same questions. What we did was we actually asked quite a lot of testing of the plain language with our non-research staff in the institute to fine-tune them. That actually helped quite a lot. So we use the same language.
Thank you. The second question is also addressed to you. The people ask, interested to know what happened next. How does research experts respond to the priorities that came out of the exercise?
Yeah, we have just finished the analysis and we are kind of planning a dissemination event sometime next month. That's when we will come to know about it. One key thing, I don't know if you noticed in the exemplar tables which you saw, was almost every time it was consensus out, it was because researchers did not agree with either the practitioner or public or both. So I think it's a good evidence of how priorities are actually different, and something probably we would have not noticed if we use Delphi, which is very commonly we have been using. So because people just conform to other groups based on personal clues. But yes, we will know how things go very soon.
Thank you. The next question is to Prashanti and Sumanth. I can imagine there's also a difference between translators of the same language. How do you account for that? Not really a question, but interesting to use pictures could also be useful to get input from illiterate people.
I think you're absolutely right. The same language people, so we have the 137 languages in Malaysia, 50 indigenous with different dialects. And Bahasa Malaysia itself is having 10 to 12 dialects. So definitely there were differences. So we had multiple training workshops with the same ethnic group translators, and we developed a lexicon with different types of dialects being included in this lexicon. And that's how they use that during the participatory research work. And Sumanth, would you want to add on the training for your translators?
Yeah, the same issue I faced during my PhD project. The best solution, what I found was having a sort of calibration exercise, discussing every day. After every interview, we used to sit and discuss, okay, what were the words the person or the interviewee misunderstood, what words you found it difficult to translate. So such discussions helped a lot, because these translators are not professional translators. We had to take social linguistic competence translators. So that was definitely a challenge, but this is a solution we found more practical and more economic.
And just to add on regarding the photographs, yes, auto photography and photo elicitation, I think it was an excellent tool. We did have participants from different socioeconomic backgrounds. We did have participants with different educational background, but still we could engage them, and all of them engaged in taking photographs and explaining those photographs. And the complex construct like uncertainty, we could explore because of this method which we employed. So thank you for that.
I think the next question is addressed to everyone. Do you have any tips for engagement of marginalized groups to participate in research? Any of you want to take it? Go.
Yeah. So we have been working on this quite a lot, mainly because our team works in India and Australia, where this is quite a big issue. The two big issues are indigenous people and rural and remote. That is there in both the countries. India has the additional complexity of difference in languages and culture. So one of the big limitations of our review, and we could clearly see that from our ratings for our research priority setting, is that we actually didn't reach rural areas quite a lot. And we didn't collect data on if there were indigenous people from India who voted or not. But we think that something was a big miss from our end when we designed the survey. So what we are now doing one in New South Wales, and we are using the same method, but we are kind of being more deliberative in nature. So we are reaching out and making contacts before doing the survey with indigenous groups, with rural hospitals, rural networks, to actually reach them so that we can disseminate the survey to them. A big advantage here in Australia is that language is not an issue, because everybody speaks English to some extent. But of course, again, some older migrants and other people might be disadvantaged of it. I think the big tip is a budget for research practice setting exercise for marginalized groups. Translators are quite costly, and there's always unforeseen costs which we are seeing because of how things go. We always or maybe we are bad at it. We always kind of underestimate the cost of how much actually will be needed to reach groups which are marginalized or difficult to reach. Yeah.
Sumanth, you also want to say something?
Yeah, during my data collection stage, initially I used to send the messages through the social media, advertisements in social media, personal contacts, but it didn't work, and the majority of the participants from the urban areas, the rural areas, and the indigenous population, I couldn't get much participation through these methods. Then I approached the local leaders and the religious leaders, and when they discuss this with the members of the community, that helped them to understand the project, and that was more engaging for them, and that helped us to recruit some of these participants from rural areas and also some of the interior communities. Here the major issue is the trust. They trust their leaders, they do not trust anybody else. So we have to go through this trust issues, and we have to engage the community leaders or religious leaders to get marginalized people participate in any of the research. Yeah, that would be my suggestion.
And
Prashanti?
Yeah, just to add on, we had experiences when we were doing Sumanth's project that participants, they were in some island and they had to travel by boats to actually come and even take healthcare. So you can imagine engaging such kind of people. We really have to reach out to them rather than they coming to us. That is one of the aspects we realized. And second thing was that cultural sensitivity, which we understood by talking to these community leaders, that they may not trust us as external people or who are not from their own ethnic groups. So we had to sort of dress up as well as include food and other practices which were included in the research projects itself for them to gain that kind of a trust. So just to add on to that, yeah.
I have to say there's one comment. I know none of you can see my face, but if you could see my excitement. This projects are very valuable. Congratulations to all of you. So that's very positive. I should add that we do a lot of work in Plymouth around kind of engaging a lot of the groups that are usually not engaged. You saw some examples of it. We also do work with like engagement, dementia, intellectual disability, and using quite creative and different ways of approaching it. So yeah, hopefully we would have more examples in the future. There's one final question, Meltu. Where and how do you expect? They pointed out it's also excellent, and then they said, where do you expect adaptation of the tool beyond your study? Any of you, Sumanth, Prashanti, you want to answer?
Prashanti can take the question.
Yeah, so currently we have not yet validated the tool, but what we think is if you look at the items in the MEL toolkit itself, it is very generic. We have given examples from the Malaysian project which we have done, but it could be applicable to any diverse groups, especially with so many countries with all the migration and diverse populations. So you can look at the items more in a generic way, but we are in the process of looking at other projects where we can actually apply this tool and validate it. So we will be very happy to share it with you if you are planning any such kind of projects, and we've given you our contact details. It'll be fantastic if you can do that as well. Thank you.
Yeah, I should add that everybody, if you want to use any of these tools or approaches, we are very happy to kind of collaborate and find ways how we can adapt in other contexts. Thanks, Claire, for this. Trust, yeah, I agree. Trust is an important issue. So I think we have answered all of the question, except anybody of the presenters want to have any last words? Any last words before we close the? No, okay. Thank you very much for everybody for participating and engaging. It was a lot of fun to do it, and hopefully it would result in some interesting future collaboration. Thank you very much, everyone. Bye.